Usually meningiomas are very slowly growing tumors. So what are the signs and symptoms of these slowly growing tumors? They can present in different ways. To start with, sometimes meningiomas can be completely silent and they can grow to a huge size. Many of my patients have asked me, doctor, if we have this kind of a tumor as it is seen on the MRI, how come we didn't know about it? So the answer to this lies in the fact that these are slowly growing tumors. When a tumor grows slowly, the surrounding brain gets time to adapt to it, and so there is no functional loss or there is no sudden increase in the intracranial tension. So they can be completely asymptomatic. However, there comes a point after which there is rapid worsening and the patient can suddenly become unconscious after that particular tip off point. So it is very important to diagnose them in time, but if they are asymptomatic, they can go unnoticed till the first symptom appears. Now, second type of symptoms are the symptoms due to raised intracranial pressure or simply increase in the pressure inside the skull. As we all know, skull is a closed cavity. It is a bony cavity, bony box. And if there is increase in the pressure, it cannot expand, right? If there is a tumor which is growing inside the abdomen, then the abdomen will increase in volume. So no such mechanism is possible in skull. So if the tumor goes on increasing in size, there is progressive increase in the intracranial pressure or intracranial tension. So it presents as headaches, vomiting, blurring of vision, sometimes double vision. At times it presents with worsening consciousness. The relatives tell us that the patient remains drowsy. So these are very common signs and symptoms of raised intracranial tension, for which if the help is sought and MRI is done, then diagnosis can be done early. The second group of symptoms, or rather the third group of symptoms, the first was asymptomatic completely, second was with raised intracranial tension, and the third is with fits or seizures. A patient gets a fit and his MRI is done and a meningioma is seen. This is one way for the meningioma to get diagnosed. The fourth type of symptom is progressive change in behavior. Now, out of so many psychiatric cases, very few are caused by brain tumors, but we have to remember this possibility. Usually it is a gradual change in personality and relatives notice it very slowly because it doesn't happen in one day. So patient becomes lethargic, he becomes depressed. Sometimes patients can have very different kinds of emotions which they report to the relatives depending on the site of the tumor. So psychiatric symptoms is another group with which meningiomas can present. The fifth group is because of the meningioma obstructing the flow of brain fluid or CSF. When it does so, there is sudden increase in the volume of the fluid inside the skull or CSF, and there can be sudden increase in pressure and patient can become unconscious. The next group of symptoms is loss of function of the neural structures which are surrounding the meningiomas. As the meningioma is increasing in size, it presses on the surrounding structures. Suppose, let's say the meningioma is growing on the left side and it presses on the motor strip, then person can have reduction in power in the right hand, right leg, right side of the face. So it is loss of nervous function. Similarly, the meningioma is growing near the cranial nerves or the nerves which come out of the brain and then go to the different structures on our face, like optic nerve, which is a nerve of vision, or vestibulocochlear nerve, which is a nerve of hearing and balance, facial nerve, which is a nerve of movement of face. So if meningioma starts pressing on these nerves, there is loss of function of these nerves. For example, the meningioma is pressing on the optic nerve, the patient will complain of progressive loss of vision. So loss of neurological function is another group of symptoms. So these are the symptoms with which patients present. And if we see these symptoms and perform the MRI investigation in time, we can catch these meningiomas early, and with modern neurosurgery they can be resected completely and cure can be achieved. So early diagnosis is very important.